Welcome, everyone. Today we're here to learn about birth control. With us, we have one of our physicians, and I'll ask her to introduce herself.
Hi everyone, my name is Dr. Kundacina. I'm a gynecologist and obstetrician at Valley Women's Health. My office is actually in Auburn. We have 4 locations and I'm in that office.
Let's start with our first question. What are the different types of birth control that are offered by a healthcare provider?
Yeah, that is an excellent question. We get a lot of people come in to talk about birth control for so many reasons. I like to present it in like a tier-based way. So I go from most effective to least effective. As you know, there are several types of birth control out there. And I always tell my patients it can take some time to figure out the best one that's right for them. So individualizing care and picking an option that's important for them and that will work well with them can take some time sometimes. So super important to come talk to your gynecologist in person about that. But a basic overview today, we go from most effective being things like the IUD, the implant, which is frequently known as an Explanon. The IUD, there's a couple of separate options. So one that is called the Mirena or the Kylena. These are the hormonal IUDs. And then we have non-hormonal options for IUDs as well. Okay. In terms of pregnancy prevention, they are the most effective forms of birth control that we have from a hormonal and non-hormonal perspective. Less than like a 1 in 100 chance in a year of a patient getting pregnant, so about less than 1% chance with either of those methods. They are implantable methods, so they do require an office visit and getting placed either in the arm or in the uterus. And then other methods that are similarly effective as those that are even more invasive are a tubal ligation, so frequently known as getting your tubes tied or tubes removed. Those are like our colloquial terms for those things, but that is a surgical operation, so you would have to be asleep for that one. It is very, very effective. Same thing, very low chance of pregnancy. And then lastly, the other surgical option, and this is more of a male option, is a vasectomy. And that's a really great option for a lot of couples who know that they're done having children. They can have it's actually an outpatient office procedure. Most gynecologists do not perform this procedure. So generally, if this is a option that patients desire to pursue, we refer you on to one of our awesome urologists and they can do this in the office even. So it's really, really low risk in that regard. So those are our most effective forms. I kind of put them all in the same tier when I'm presenting this information to patients. And then next we have things that require a patient to take them daily or at least a couple times a week or once a month or even 3 times in a year. So these things that require a little bit more follow-up and use by the patient. So these things include and are all kind of in that same level of efficacy as a group. Birth control pills, so either progesterone or estrogen and progesterone containing pills. The depot shot is an option for patients. The patch and the ring, and these all kind of fall in the same category of efficacy. Typical use and versus perfect use is what we talk about with birth control efficacy. And with that, it's anywhere from like 92-93% prevention of pregnancy within a year. So you have about an 7 to 8% chance of getting pregnant on one of these methods with typical use. If they're used perfectly, that percentage goes up to like 98-99%, so much higher. Okay. With a pill, you do have to remember to take a pill every day, so that doesn't always work well for everybody. With the patch, it's once a week, which is great, so a little bit less remembering. The rings get changed out every month. And then the shots are about every 3 months you got to come in for a shot in the office. So a little bit more involved, but is less of a daily worry for a lot of patients.
Now that you've covered medical and procedural options, what other options are there for birth control?
Yeah, so obviously these options that we've talked about generally require a prescription or a surgery or referral to a different provider, like for the vasectomy. But there are things you can get over the counter. So now there's, condoms that we can use that has to be used every single time for it to be effective against pregnancy. There are female condoms and male condoms. They're about generally, when used correctly, the same efficacy. So condoms are about 85 to 90% effective with typical use and 100% effective when used perfectly. or close to 100% actually. And then the other options are things like spermicides, again, very user dependent, need to be used correctly in order to be effective. The other option for those patients who are not interested in using any contraceptives in terms of condoms or pills or procedures is if you have a regular period and you want to just monitor your cycle. We call this more of a natural family planning approach, but it only works well for patients who have regular cycles and regular, 25 to 35 day cycles, and they can track ovulation. And patients can track ovulation based off a fertility window. This is either done through an app or body temperature monitoring or peeing on a stick in your fertile window period, which is about 14 days before you have a period, will be when you ovulate. So it's always length of your cycle minus 14 days. That's when we expect ovulation to occur. And we generally recommend patients avoid sex when they're trying to use this method a couple days before and a couple days after. So that week that you might be most fertile would be ideal to avoid intercourse. But this only works for patients who have regular periods. So if it's something that you're interested in, I would definitely talk to your physician about it.
One of the options you mentioned, birth control pills, is now available over the counter. What can you tell us about that?
Yeah, so it's called Opill as the brand name. It's a very common generic progesterone medication that we've had for several years, and now it's available commercially over the counter without a prescription. So it's really great in terms of access for patients. Very safe medication overall. Patients can pick it up themselves, talk to the pharmacist if they have any concerns. Generally, most patients, even with chronic medical conditions, can take over-the-counter progesterone pills. They don't increase your risk of clotting or anything like that. Obviously, if you have any concerns about taking a medication over the counter, please talk to your doctor. But it's great that we have an option. A lot of countries offer over-the-counter birth control. So it's great if you're worried about pregnancy and are having trouble getting into a doctor's office to pick up over-the-counter. And yeah, it helps to increase access to contraceptive that's a little bit more effective than just a condom or abstinence in and of itself.
What are some common side effects with birth control, and how can these be managed?
Yeah, so the most common side effect patients have from most birth controls is irregular bleeding. Generally, improves in about 3 months. So I usually tell my patients, give it a shot, give it 3 months. Usually the bleeding will get better, okay? And if it doesn't, please come back. That's something that we can always talk about further and change, your prescription or change the form or either way. But the other common side effects for hormonal birth controls are nausea, sometimes breast tenderness. Common misconception that I get asked a lot in the office is this birth control doctor going to make me gain weight? And actually, the evidence does not support that birth control causes weight gain. There is a single one that I generally kind of warn patients about that may cause weight gain. There may be some association there, although the studies are not super conclusive, but Depo-Provera is the shot. So it's a high dose of progesterone that you get an injection for every 3 months, may be associated with weight gain. So that's a common question I get from most of my patients, but everything else doesn't really seem to have that association when we look at the evidence behind it. And then lastly, another common side effect is mood changes. So patients who are prone to mood changes, or even if you're not, sometimes it can affect how you feel, especially with an oral hormonal method. So, if a patient is really worried about that, I may recommend a different non-oral form, as those orals and injections tend to have more of those side effects. But those are the most common ones.
Are there any risks with being on birth control, including long-term risks?
This is a great question. So I get this question also a lot in the office, as people can be a little bit scared, especially with anything with hormones in it. I think hormones sometimes get a bad rep. With most estrogen-containing birth controls, the most common thing that patients ask me about is, oh, am I going to have a blood clot? What is my risk for that? And I usually tell people, with average risk of having blood clots, meaning you don't have any medical conditions that predispose you to an increased risk for that, it's very low. It's actually about the same or less than being pregnant. So the risk of that is less than 0.25%, and it actually doesn't increase your overall risk that much. So when we talk about, oh yeah, you might read it like, oh, increase in twofold risk of blood clots. So you get a lot of that stuff. But if you look at the absolute numbers, they're really quite low. So it's less than 0.5% total. And generally that risk is in the first 2 to 3 months of use. If you haven't had a blood clot in that period of time, it's unlikely to develop on any sort of hormonal pill or other hormonal forms of birth control. The other common thing I get about is like, doc, like, I'm worried about cancer. Like, I don't want to get breast cancer or other kinds of cancer from being on birth control. And then what I say to that is if you have an average cancer risk, being on long-term birth control does not seem to increase your risk of breast cancer at all. There are some mixed studies, but overall it seems very reassuring that does not seem to be the case, depending on which study you look at. And actually birth control helps decrease your risk of cancer. It helps decrease the risk of uterine cancer and ovarian cancer. And so I always like to try to harp on the positives as well. So you're also with long-term use. So more than 5 to 10 years of use, patients actually can have a decreased risk in other certain types of cancer. So overall, it's actually very, very safe and very easy for patients to actually help decrease their risk as well as help prevent against pregnancy.
Are there reasons for taking birth control besides preventing pregnancy?
Great question. There are so many reasons to be on birth control. It's why I love it. So even though you're not trying to prevent pregnancy, a lot of patients have heavy periods or pain with periods, and it's a great option for those patients to help decrease the amount of bleeding they have, as well as decrease the pain that they have on their periods, or even not have a period at all with certain forms of birth control. And I always tell my patients, it is totally fine for you not to have a period if you're on a birth control medication that has hormones in it. That means that we're kind of hijacking your menstrual system and controlling the bleeding and the pain, and that's okay. The problem when we don't have regular periods and we're not on birth control, that's definitely not normal. That's definitely something that needs to be evaluated by your doctor and something to come talk to your doctor about. But overall, we can see a huge benefit in bleeding. Sometimes with pain and bleeding, we also think of fibroids as well as endometriosis. These are common conditions that we also use birth control pills to help with those symptoms of those conditions. So if that's something that you have or have been told you have, it's great to come talk to your provider about potentially starting a birth control to help with those symptoms. And there are some benefits in those populations to help, especially with endometriosis, to help patients preserve their fertility by being on birth control. So not only is it preventing current pregnancy, but it may help preserve and prevent conditions from getting worse, especially something like endometriosis that can help you with your fertility desires in the future.
How do I choose what type of birth control is right for me?
So great question. I love to go through all the options with my patients. It's really important to also know your medical history. So just because you might see something on social media that sounds great or doesn't sound great, that person is one person who's had one experience. So it's really important to talk to your doctor, your provider about the options and what options are best for you, because every person is an individual. We all have different risk factors. We all have different medical conditions, and you may benefit from one form of birth control more than another based off what your medical conditions are. So it's really, really important to talk to someone that knows you and your personal history so that you can get the best care.
What type of provider should you see for birth control options?
Yeah, I recommend going to the person that's easiest for you to go to. So if you already have a gynecologist, that's great. Come see us. We love talking about birth control options. If you're not established with one yet, then please, see your primary care provider. Most primary care providers are equipped to handle birth control and options. And, so it's easier to get in with them. And especially since birth control can be a time-sensitive thing. So other providers that help in women's health are nurse practitioners who are great in women's health, as well as primary care and our midwives. And at Valley, we have all of these options. So it's whoever you can get in touch with is great, but we're also happy to see you here and at Valley Women's Health and help to explain your options and hopefully get you in the best fit for your birth control.
Thank you for answering our questions, Dr. Kundacina. And for those of you watching, if you'd like to learn more, please go to our website.